Hi there, this is Anna Dolopo, and today we're going to do a short and sweet video about posture. So I've been a licensed acupuncturist since 1999, and I treat a lot of pain cases here. But I've been meaning to do this video because a few months ago I was doing some observation, and this one was with a colleague who's a medical doctor, and she has a busy OBGYN practice. And I was in her office doing some observation of how she interacts with her patients. And she had a patient who was obviously a woman. She's an OBGYN. And her 8-year-old son was sitting in the chair like this with his phone. Like, I'm going to sit and show you. This is how he was. And his neck was just, and no one said anything. His mom didn't say anything. And, I'm just there to observe, so I didn't want to intrude. But I thought to myself, I really need to make a video because I have children. They're 17, 11, and 3. And if they're on the phone, which I don't want them to be, but if they are, I want their head against something and perhaps like a pillow or something so that their neck's not down. For every inch you're forward, you're putting a lot more weight on your neck and shoulders, and your spine is not straight. So I really want to just make this short video. You get the point already. I see this everywhere. And then when people come here and they're complaining about neck and shoulder pain, I just share the obvious, especially if you're tall. I'm short. I'm barely pushing 5'1", so everyone to me is tall. So I'm having to do this, but I'm usually very cognizant of my posture. I've been studying Chinese medicine since 1994. I've been receiving chiropractic also since 1994. So I've worked with chiropractors. So and I have patients who are physical therapists and other types of medical professionals. So I'm pretty aware of the importance of having a really great posture. Many people don't know this, but I've also been a massage therapist since 1996. So making sure that the posture is correct. The turnover rate for most massage therapists in the profession is maybe about 2 to 3 years because many massage therapists don't know how to hold the correct stance, don't know how to put the table correctly. Many do, but then when they start having tightness in the shoulders and the arms and the neck and shoulders, it tells me they themselves don't do a lot of self-care, they don't do the stretching and stuff like that. So I did a video. It's called Stretch Your Forearm. So go to Elements in Harmony, go to videos, and you'll see I did a video. I was pregnant at the time. I show you how to stretch your forearms, but it's much more than just stretching your forearms. It's much more than stretching your neck and shoulders. It's much more than this. I mean, this is just, I'm doing like a half job doing it, but just right there, I'm already moving my muscles. I'm already moving my neck and shoulders. So I want everyone who's watching this to be very, very aware of your posture, and especially with your children. Watch your children. They shouldn't be like this. Okay? The posture should be straight. Walk like a ballerina. My children are dancers, so I even have to tell them, sit up straight. Your parents were always saying, sit up straight. This is the era where everyone's on their phone. Go to the mall, everyone's looking at their phone. They're, not paying attention, and they're, bumping into things because they're not aware of their surroundings. So that's a lecture in and of itself. That's a discussion in and of itself. But please, if you don't want to have neck and shoulder pain, you may really want to consider watching your posture. Just that alone will fix many of the. Talk to your chiropractor, talk to your acupuncturist, talk to your medical doctor, talk to your physical therapist, talk to your massage therapist, anyone who's in the business of fixing pain, healing pain, correcting musculoskeletal issues. They should talk to you about your posture. So today's video is about making sure you have correct posture. I did some body work recently on 3 people, and in the treatment, I worked like 10 minutes each arm. And they're like, oh my gosh, Anna, Why is it so painful? I feel like you're touching muscles that I haven't touched, that I haven't felt before. And I said, because you haven't been stretching your forearms. I asked them, do you text? Do you type? Do you cook? Do you clean? Do you carry a baby? And the majority of people would say, why, yes, I do. So, for example, when you're doing yoga and you're doing like, stretches to stretch these muscles, and it feels very different than, feels awkward or feels different or feels like, wow, that doesn't feel right. Well, that's because you're always, it does feel different, but you're feeling the muscle stretching. You really need to stretch your muscles. I'm just showing you quickly, but you can go online. I'm sure there are a lot of medical professionals who will show you how to stretch the forearms. I have a video on stretching the forearms, but you want to stretch the neck to your waist, the waist down. I'm teaching Qigong tomorrow morning. I teach Qigong at the beach 1 to 2 Sundays a month. So if you're interested, please text me at 619-341-4341 and I'll send you the information. It's fun. It's at the beach and we do a lot of stretching also. Stretching is so imperative. Proper posture is imperative. You must do this. And for the sake of the children, please, number one, get them off Wi-Fi. And number two, that's just my opinion. And number two, if they have to be on their phone, make sure that they're not like this. I get it. I got a 17-year-old who has a whole gaming setup. She's streaming. She's, playing video games. This right here, this movement, that's really inflaming the forearms. Really, really inflaming the forearms. Like, so right here. So my first job when I was 15, I did it for a year or so, a couple of years before I graduated. Right here. These forearms, I used to have Popeye forearms, my right arm, because that was my scooping. I was doing an ice cream job. If you text, I have a secondary phone that's a Samsung and it folds out. That's a lot of, that's more keyboard. Your phone, if you're doing an iPhone. So I have both. There's a lot of this motion. So guess what? People come in for this thenar eminence pain. Oh, why does it hurt? Anna, why does it hurt? Oh, because you're doing this all day. Imagine you're running and you never stretch your calves. That's what it is. This is like right here, right here. I treat a lot of runners. And those that are professional runners, ultra runners and people like that, or, CrossFit or Ironman, they know the importance of stretching, using the roller, getting massages. If you're an athlete, you got to do a lot of self-care. One of my patients, I'm so happy that she started. She's in her 40s, and she, for the last 6 months, has taken up golfing. So she has a trainer, and she's learning proper posture. She's been doing a lot more range, going on the golf range, and also learning how to play a game. But the issue is now she's really feeling her shoulders. She's feeling her shoulders. She's feeling the elbow, golfer's elbow. She's feeling, because she's right-handed. So I'm facing my right. She's feeling the ribs. She's having lumbar issues. She's having maybe now she's having some arch issues. So why? Why is this the case? Because stretching is probably not as important to her right now. But now it is. Now it is, because she's starting to feel the aches and pains. So, people who play tennis, the lateral motion, the knees, the ankles, you have to stretch. So I know I started this off with posture, but it's, on behalf of everyone who treats people, I implore you to please make it a point to watch your posture, stretch, and do your best to not do this. Do your best to not do this. It is rampant around the world. I've gone to different countries and it's the same thing. It doesn't matter what color a person is. It doesn't matter what gender a person is. Everyone's doing this. This slouching, your belly sticking out, you got to have good posture. So I think you got the point. Please, especially for the children, my camera is like this. I'm right in front of my laptop. There are a few books underneath, so I'm, straight. I also have, something else that helps me, but I prefer the books underneath so that I'm straight. Now, if I want to share this, if you're at a desk, your mouse should be like this. In my opinion, you might want to hire an ergonomist, someone who's a professional ergonomic person, and they'll help you make sure that your setup is correct at home. Now, the issue with people working at home is that they don't have this correct work environment. Their ergonomics at home is not the same as it is probably at work. So in the past year, I've been treating a lot of pain simply of people who are not set up correctly. People are working on the couch, so you're doing this, and then after a while you're having the lumbar pain. You're just not set up correctly. So you want to invest in the correct chair and if your legs are hanging, ladies, you got to get something for a little stool for your legs so you don't start having knee pain, hip pain, back pain. My daughter has the perfect, because she had to go to school at home last year. I got her this. It happened to be a gaming chair, and I had a phone consultation the other day, and I sat in her room at her desk, and I realized, oh my gosh, this gaming chair is perfect. So I do recommend that if you want to try a gaming chair, go to Staples or something like that. That's where we tried it, and it was perfect. It had the perfect support for the lumbar, it had the perfect support for the neck, and she was erect. She was straight. And then you want to make sure that this, mouse arm is like an L. It's like an L. Otherwise, what happens is if you're doing this, I am going to treat you here, and here. This is what a lot of people come in for, neck and shoulders. So it's like, oh, I have the perfect chair. No. If your arm is out, you're going to end up having pain. You want to keep the elbow down. It should look like an L. So I may be completely wrong. Go check with another doctor, an ergonomics professional, your chiropractor, your physical therapist, your massage therapist. But these are changes that I made in my life so I don't have pain, because I started having that before. Also, you might want to switch it up. I don't use a mouse. I use a little keyboard mouse on my laptop, so I don't have a monitor. So, they have all kinds of devices to make sure that you are set up correctly, ergonomically. Pay attention to that, and if necessary, then hire someone. Otherwise, you're going to end up hurting yourself. I've had people come in from hurting themselves from incorrect, posture in yoga. They hurt themselves, they're having elbow pain, and then they exacerbate it at yoga. People who play golf, people who play baseball. These pitchers, they ice, and they ice their arms after a game, or they ice themselves. There are people who are that you don't work out all week, and then you go and you play a game, and then you're in pain the whole week. So if you're in pain, you want to come in right away. My point with all that is, if you are over 30 years old and you're not consistently doing self-care, and then you go and you learn a new sport, or you go back on basketball, you go back on football, you go back on tennis, but you hadn't done it in a while, and you play all day, and now, oh my God, I'm in so much pain, is because you went back too furiously, you went back too hard, too fast, and you probably didn't stretch. So it's kind of a little bit, I touched on a bunch of things. Number 1, posture. Number 2, watch yourself. You're ergonomically at your desk. Number 3, and the most important one, is watch how your children's posture is. That's the word of the day, posture and stretching. Posture and stretching. So I talked about a few things, but that's the main thing that I wanted to share. And I hope you have a great day. The name of my website is Elements in Harmony, Acupuncture, and Chinese Herbs. My office number is 949-305-1703. And you can text me at 619-341-4341. Take care. Have a great day.